Consultant, NITI Aayog, Government of India, and the Vice President Clinical Services of DTTMI Health India Private Limited, Massachusetts Institute of Technology Digital Health Startup. Dr. Arora will be delivering Sir Joseph Moore Memorial Lecture.
Namaskar, thank you for May I request someone to put up the presentation, please? Thank you. So if we could have it in slideshow mode, please. Yes, thank you very much. Very grateful to be here. Thank you for having me. I'm Dr. Sumona and I'll be speaking to you about my thoughts on technology and healthcare. Thank you. Next, please. Now, this is a standard thing that we in the government always use. This is a personal, these are entirely personal views, not of any organization, especially of Government of India. Next, please. Technology and healthcare is a very vast topic. So for the ease of discussion, we can just divide it into the scope, why India is at a specific advantage and the conclusion. Next, please. If we were to look at the scope of technology in healthcare, in fact, it's all pervasive across the healthcare spectrum, right from wellness to curative health, right from individual health to public health. So for the ease of discussion, if we can divide it into individual health and public health, then that's how we progress. Next, please. Now, individual health, which is the health of you and me at the individual level, is both preventive as well as curative. Next, please. Starting with preventive health, there's a lot of technology available today in the form of wearable devices, which can help monitor our vitals, our ECG. It can even help, post-prandial blood glucose monitoring in patients who are maybe pre-diabetic. So there are multiple devices which are put on the patients, on the citizen's body, which can pick up the various vitals and flag if anything is out of range. Next, please. There are also smart yoga mats. I was very surprised to see which can help guide you through various procedures. And if you see the emphasis on yoga, it's even been adopted by the United Nations General Assembly. So we now have smart yoga mats which can help you take you through procedures and also monitor your vitals as you're doing that. Take you through postures and monitor your vitals as you do that. Even perhaps help correct posture while you do it. Next, please. There are also smart glasses which can monitor your brain waves, which can monitor body position. Next, please. So prevention is always better than cure, and technology is helping us in that. Next, please. Moving on to the curative part of technology in individual health. Next. Next. Now, if you see on the screen, curative part of health can be in transit to hospital, within hospital care and out of hospital care. And it really impacts the way the health records are maintained. It helps doctors make decisions, clinical decisions, perform higher precision surgeries, help in continuum of care, and all of these together help in better clinical outcomes for the patient. Next. Now let us look at some illustrations for individual health, the curative part of the presentation. Next, please. Now this is what you and I are always accustomed to see in hospitals. These are patients waiting for the doctor in the OPD. Next. Which is now changing to telemedicine. So the patient can sit at home and see the doctor across the screen. Of course, there will be cases which will need to be seen in hospital. But as per studies, we are seeing almost 75 to 80% of the cases can be managed out of hospital. Next. We are so accustomed to see patient records like this. Many of us end up losing our records. Many of us, when we go from one city to another, using our records in transit. Now this is changing next to digital records, when you have your records at the click of a button. Next please. So this is digital records. You have it in your palm, when you can share it with your doctor, you can share it with your healthcare provider, you can send it to another doctor in another city for second opinion, etc. Next. We are so used to doctors performing complicated surgeries, simple surgeries in operation theatres. But we need to remember doctors are also human beings, and they get just one take at it. One shot at cutting open a patient and stitching him back. Now they are very complicated surgeries at times, which actually can be practiced before they touch the patient, before they put the scalpel to the skin, using 3D imprinting. Next. So this is how they are practicing now. Using 3D imprinting and practicing the actual surgery on that particular patient without cutting open the patient, so that they know what pitfalls they can come across while operating and then prevent that. Again, leading to better surgical outcomes. Next. Staying on with surgery, robotic surgery is nothing new, but we are seeing advanced versions coming forward now, especially with higher connectivity in the form of 5G. So here it helps prevent human errors, it helps increase surgical precision, and it can also end up, the surgeon can also perform surgery when the patient is not in the same city. So the robotic arms are already in use in many hospitals. Shortly, hopefully, we'll see a situation with adequate safeguards, of course, where intercity surgeries can also be performed. Next. Now, this is another use of robotics, which is non-doctor related, but which is helping patients. Kindly play it.
This is not a test.
So these are nurse robots which are being employed in hospitals, which help ease the work of nurses.
To suit patients.
So the nurses can focus on the more important work of providing clinical care. This is happening in Southeast Asia already.
A little bit.
I think there's some problem with the audio.
From our staff and patients.
Dr. Nuna, director of the Mongkut Tuatana Hospital, says they commissioned these robots to help staff, not to replace them.
Now nurse has more time with the patients and work with other important things.
So nurse robots are already in place. These are robotic assistants which are sent home with the patient post-discharge, which remind the patient of their medication, their intervals of medication, how long they have to take the medication, and they enter it into the data in the tablet, which then goes into the hospital records. So when the next time the patient visits the hospital, the doctor has the entire clinical data in front of him as to what happens to the patient. Next, please. Now we've been talking about hospitals, but what about before hospital? The so-called crucial golden hour. We are all aware that in certain cases you need to get the patient to the hospital and treatment ASAP, preferably within 60 minutes, in some cases as short as 15 minutes. Now with smart ambulances coming in, you could get expert consultation for the patient in the ambulance in real time through teleconsult, facilitated by higher connectivity and lower latency using 5G. There's a lot of work which is already happening in this. Supportable X-rays can be done en route, and basic treatment given to stabilize the patient before the patient reaches the hospital. Next, please. Now, as doctors deal with a plethora of medical literature, there are thousands and thousands of peer-reviewed journals that come out every year. It's not possible humanly for them to read each one of them. Further, in a case like an ICU patient who has so many blood tests, urine tests, multiple parameters to be monitored, in that particular case, artificial intelligence-enabled clinical decision support systems are helping doctors out. They cannot replace doctors. However, they give a very good support system for them to make that clinical decision and decide on the right line of treatment for the patient. Next, please. Now, this is a very interesting thing that happened during the pandemic. Next. So, this is what we see as Can you click next? So this is how we use a stethoscope. Next. The stethoscope has an earpiece which goes into the ear and a diaphragm which goes onto the chest or the back of the patient or the abdomen. Next. Now during COVID, what happened was the doctors were dressed up like this. So how do they put the stethoscope in their ears? How do they put the earpiece in their ears? So there was a very interesting invention that happened. So we'll try and play the video for you. This was in our own country. Next please. Kindly play the video.
This is what they have made. They have cut the stethoscope.
Okay, so the audio is not playing again. So what they did was they chopped off the bell and the diaphragm part of the stethoscope. They inserted a device in that. So it became wireless. Then they handed it over to the patient or the patient's attendant. And the patient or the patient's attendant put it on the chest or back. And the doctor could hear the sound through this phone. So this was a very recent invention during the pandemic in one of our southern states. Next please. Now we looked at in hospital care, we looked at during transit. Now what about out of hospital care? Once the patient say gets discharged. Now this is a real case of one of the digital platforms that I've seen. Now this was a 57-year-old lady who had undergone a knee replacement. There was a team of doctors that was monitoring her on a digital platform once she went home. So this was a team of doctors, nurses, physiotherapists, dietitians and the clinical psychologist. Interestingly, the clinical psychologist identified some mental health deterioration, pessimism, borderline suicidal thoughts, which were picked up on the digital platform by the psychologist, immediately escalated to the primary surgeon and timely intervention given. The second thing was that the team was able to manage the surgical site. They had a technology where they could take pictures of the surgical site. Next please. So if you can see in these images, these are real images. So in January of this particular year, the wound was healthy. Towards February, it got infected. Now this was picked up remotely on the digital platform and immediately escalated and action taken by the primary surgeon by shifting the patient to hospital. This would have otherwise gone unnoticed till further much more time had passed because the patient was due for a consult only after a month. So this is early detection and hence improving patient outcomes. Next please. Now coming on to public health. Next. Now, ASHA is the backbone of the Indian public health system. ASHAs in most states now, if you would see, have something called an e-ASHA app on their mobile devices. And you can see on the left, it's in Telugu. In the center, I think in the state in North India. And on the right, it shows you up close and clearly how e-ASHA works. So they actually have patient information at the click of a button. Next. This is the 108 ambulance system, smart ambulances, both advanced and basic life support ambulances which are GPS enabled for easy tracking and immediate reach. Next please. Telemedicine, of course, there is both there in the private sector and in the government sector. In the government sector it's called e-Sanjeevani OPD. So far almost more than 8 crore consultations have been done. And it's literally taking the specialist care to the doorsteps in the villages, to the sub-sector level. Because specialists are very, very less available in rural health, in the rural system. So through e-Sanjeevani, we are seeing that a lot of specialist consults are happening through the telemedicine right till the sub-sector level. This of course is happening in the private sector across tier 1 and tier 2 cities as well. Next please. This is a landmark mission of India, Ayushman Bharat Digital Mission, which is taking upon the effort of digitizing healthcare. Next. Now in this mission, if you see on the left in the blue box, there's a Aadhaar ID which is Ayushman Bharat Health Account ID which each citizen would have. a doctor, whether it's a Ayush professional, etc. So this would definitely help deal with the problem of quackery. The ultimate aim is to build longitudinal health record available to the health workers, available to the patient. Now what does it mean? Now suppose I am the patient and I have visited, say, a government hospital, I've visited a lab, I've visited a pharmacy, I've visited a private hospital. This particular system will help me have all of that data at a click of a button. It will be up to me to consent to share it with a doctor or not share it with a doctor, to share it with a doctor for a particular time limit. Now what will this do for the public health system? This will give access, of course anonymized, it will not disclose patient identity, to the healthcare workers of the programs in their jurisdiction. So they will know who has, undergone what treatment in which place and what is pending. One step further would be next is at the national level, where when systems have access to large-scale patient data, which when aggregated, anonymized and analyzed, can be used to identify healthcare trends, patterns, insights, and thereby inform policy and help improve science delivery. So such data will help people like me for prudent policy making. What does it mean? Basically, when you aggregate patient data in a particular phase, it might come a time when we can go and predict to the level as to which organism is prevalent in which part of India and is sensitive to which antibiotic, resistant to which antibiotic. So that level of detail for public health planning, public health intervention will be available. Next please. Now before I go here, I'll just take a pause. We've already seen the success of the COVID platform. I've had friends coming from the US saying, oh, my vaccination is in the form of a piece of paper which has been tattered. So I've got it laminated. And I've had the privilege to tell them, look, my vaccination status is in my mobile phone. So we've seen the way technology has already improved its world. This is something recently which has been done in Meghalaya, which is using drones to transport medication and vaccines. Now Meghalaya has slightly difficult terrain. Healthcare workers need to go on foot because there are areas when it rains, vehicles cannot go. So a distance of say 30 kilometers, 40 kilometers takes them 4 to 5 to 6 hours to cover on foot. Drones have recently been deployed. The state government has done extremely creditable work and it has cut down the transport time to 30 minutes. Next please. This is a video we'll see of the drone technology. all have the particular section of society has general accounts. In India, the law is very clear that the patient records are the property of the patients. In the US, that's not the case. In Europe, some countries, it's not the case. In China, it's not the case. So that makes it very easy. The patient has the right to share the records, the right to deny records. It makes that system of digital health very easy. The ecosystem, the technology ecosystem, the human capital that India has is the best in the world. The startup system in India is fantastic. There's one unicorn out of 10 unicorns that comes out of India. Telemedicine guidelines. Now these came out around March 2020. Very, very progressive guidelines. Very timely, I would say, during the pandemic, when the pandemic was just starting out, which legalizes and puts in place an entire system of handling a patient over a telemedicine platform. And recently, of course, the 5G connectivity, which reduces, which increases the transmission speed, reduces the latency. So India is at a specific advantage. Next, please. The world is changing very, very fast, and we cannot explore a new world with old maps. Next. Conclusion. Now, technology in healthcare has very vast application, very, very vast potential. However, technology needs to ensure data privacy and patient confidentiality. It is very important to know when to use technology, but I would say more important than that is to know when not to use technology. Patients should always continue to be at the center of the healthcare delivery system, right from the wellness spectrum to the curative health. Next. Healthy citizens are the greatest asset any nation can have. Next. Now, this is a very, very beautiful saying, for he who has health has hope, and he who has hope has everything. Next. Thank you. It has been a pleasure addressing this audience. Thank you for your time and patience. Jai.
Thank you, ma'am. I now call upon our third keynote speaker, Professor Dr. Johnson Alex, Professor of Clinical Psychology and Director, Research, Chinmaya Vishwavidyapeeth, Kochi, Kerala, to come and deliver the Wilhelm Wundt Memorial Lecture.
Continuous keynote speeches. I think I know everybody is tired. This is the last hour. I will try to finish it, make it very short and soon, so that we'll have a break soon. We have seen from morning different topic we deliberated, from brain development till robotic surgery. We can see we are actually working on these different projects and community activities aiming for the quality of life of the individual. So we have to think in terms of that. Mental health is actually, we have to give a primary priority, otherwise all this technology will go in vain. So now the outline of the presentation, I would like to simply mention about the child and adolescents, the current scenario of the statistics with respect to the mental health problem they are facing. And we will discuss about the resilience and how to improve, what are the components associated with the resilience, and what are the parenting strategies to support the building of resilience skills and the interventions. With that, we'll conclude. And you know that World Health Organization, as you know, after pandemic, COVID pandemic, the rise of mental health problem is actually in very progressing stage. Progressively it is increasing. You can see the children are having 1 in 7 children are having a mental health problem, the age between 10 and 19 years. It may be an exam anxiety or depression, or maybe some sort of obsessions or some sort of fear or irrational fears. All those things can happen in the child and adolescent population. Depression, anxiety and behavioral problems are, you can see in the priority, in the top place. And also you can see WHO reported, in this age population, suicide is the fourth leading cause of death. And if you can imagine that if we are not addressing this, what is going to happen? And National Institute of Healthcare Management 2022, they reported that the rise is actually, the problem is actually increasing, especially the anxiety problem among the teenage population. Similarly, you can see the studies between 2000 and 2017, the increase of suicide rate among this particular population. Especially you can see the age between 10 and 14, the increase is 67%. Other age group is also not less, but you can see that there is a steady progress with respect to suicide rate. And statistics very clearly indicate that ADHD, anxiety, conduct problems, all those things are actually reported very widely with respect to this age population. And we have to, this is an alarming or warning sign for to devise a very good psychological intervention for those population, especially in the school population. And the studies, you can see that the depression, anxiety and behavioral disorders are actually increasing with respect to the age, and also in this, the 10 and 19 years is a crucial period. There is a study reported in US, Behavioral Health Integration and Pediatric Primary Care. They reported that 1 in 7 children are facing some sort of behavioral problems or mental health issues. So when it comes to India, the study reported, the Savita Malhotra, the study reported that 23.3% of the school population are actually undergoing some sort of mental health problem. So these are the statistics. So when you think about parents, no one would like to go for their children with respect to any mental health issue, or nobody wanted to get their children with some anxiety or exam anxiety or depression. So always we have to, they are thinking about a perfect children. The concept of perfect children are, and they are not actually thinking about every kid, every children should get full A+ in their academic performance, or they should not smoke, or they should not have any unusual behavior. These are the dreams, parents' dreams. So when in that context, if we think about resilience, we have to understand what is resilience. Resilience is nothing but it's not an exemplary success in the life. You have to understand that, or attaining a A+ in all the subjects, or maybe we can say having a whatever you want, but it is actually nothing but it is adaptive capacity of a children or an adult to cope up with the adversities. Because we are actually living in the era of changing world. We can't predict. We were actually faced one pandemic. It was actually it was a big turbulence to our human life, and it really affected the quality of life of the individual. And when you think about resilience, we should think about sustainability. How much not only adversity, cope up with the adversities, but how much they are able to, children are able to sustain their pursuit of positive growth, or maybe how much they are able to sustain the quality of life in their day-to-day life. So resilience, as I mentioned earlier, it is not an exemplary life or successful life. It is actually just as simple as it is how we are cope up with day-to-day small stress or challenges what we are facing. So you can see that when we have adversities, how we are actually bounced back to the normalcy, how we are maintaining the normal situation. This is what we have to think about resilience intervention. I am not going to the history of the resilience because of lack of shortage of time. But you should know that Rutter, Norman Germesi and Werner, they have conducted landmark studies in this field. Rutter actually dealt with the biological and genetical factors related to resiliency. Germesi is actually outlined about the ecological view. What are the environmental factors contributing the children's resilience development or the positive mental health. And whereas you can see Werner made a groundbreaking longitudinal study in infants with respect to the ecological, as I mentioned, the morning Professor Arun mentioned about the prenatal period, postnatal periods are very, very important. As you know that it is actually development, it will help the development of the child's brain as well as it will ensure the quality of life. And Sunia Lather and Anmuston, they have mentioned different aspects, they have conducted different landmark studies, and it all supporting that actually resilience is the key skill during the developmental stage. Anyone or any children should attain it so that they will not face any difficulties. Even though they face any adversities, they can manage well. So we know that, we think that we are actually born as a boy or girl, and then we'll go to kindergarten, and then we will pass from first standard, second standard, and now you are actually undergoing a professional education. In this period, we had so many different issues you have faced. Some people are actually broken, mentally had a breakup, and some people are had problems in terms of personality, or some people are had anxiety and depressions, different problems. But how much we are able to cope up, that actually determine our quality of life. So resilient action is actually nothing but maintain homeostasis. Like you should know that when we are away from the normality, we have to bring back our normal life into the normality. And again, you should know that we have to aware about what is going on and what is our choice and what are the preferences. And always actually we have a tendency to look others. Always we are comparing with others and set the standards. And we are actually having, the parents are actually lacking to provide training to face the failures, because nowadays, earlier, the system, family system was actually, there are lots of supportive systems in the family, but now it became a nuclear. So less support system in the family. Not only that, the parents, both parents are working parents, and they will not get enough time to spend quality of time with the children. So they are actually building in their own life actually. So most of the time children are actually spending more time. Almost you can say that there is a recent informal survey conducted among our students, and they are spending 4 to 5 hours per day in smartphone or internet, and they don't have any other activities, alternative activities, or they are not wished to go for any other alternative activities such as outdoor games or indoor physical games, nothing like that. They are preferred to be in their smartphone by using smartphone or internet. So they should aware what is happening. Self-reflection should happen. Otherwise, as they grow up, there will be a problem and they may not be able to face that. So, as you know that there are some ingredients to build the resilience, and we should learn not to something, yes to something. But we have to know the early stages of development, how the parents protect them, and Sometimes parents some messages in chaotic situation, they will say you are good for nothing, and that may affect their self-esteem. So that can influence the development of the resilience. And if you know, the parents plays a key role that I will discuss in another slide with respect to building up the resilience skill. And you know, that Ginsberg mentioned the 7 crucial C's to build up the resilience among individuals. And you can see it is starting from competence, confidence, connection, character, contribution, and coping and control. And this we will briefly discuss. And you know, competence is actually ability to know oneself and ability to handle our own situation. If the child when they are reaching to high school or in primary school or in upper primary school, whether they are able to manage their day-to-day routine themselves or whether they are able to manage the problem-solving situations by themselves, that is very important. So that is called the competence. And it occurs through experience. If parents are not providing the exposure, some parents are overprotective. They are not giving a chance to solve their problems their own way. They will provide everything, and so they will become mute, and after they start themselves independent life, they will not be able to aware about what is how to manage the situation. So we have to provide the experience, and that is we should trust their own judgment, make responsibilities and choices, and face difficult situations so that we can build up the competencies. And second is actually confidence. It is a true confidence, a solid belief in ourselves or one's own abilities rooted in the competence. It is connected to the previous component. And third one is connection. That's very important. Usually, routinely, a child morning start from the home, go to the school, then go back to the home again. No outside interaction or less opportunity to interact with other people. Maybe friends, school, a community level, or strong values. As you know, this very clearly we have experienced during the pandemic, COVID pandemic. All education was in the online mode, and the disruption and the increase of mental health problems were very high. And that's the best example we can say, connection. Human being is basically a social animal, and without connection, proper connection, we cannot improve. And so connection is very important to build up a strong values in our day-to-day life. And this family plays a central role and central force, because family is the first training center. Though children are spending more time in the school or in the college settings, family is the core training center. You can see that there they should practice some religious or educational or athletics, or maybe we can see some that related the activities which can connect with others and build the strong values. And the other component is related to character. If you lose, if you gain everything, if you have a good qualification, if you have a good professional education, but if you lost your character, you can say that if you don't know the sense of right and wrong, and that can actually build up a lack of wrong self-worth, and it may develop, ruin your confidence, self-confidence, and it will stagnate your life, and so that you may face so many mental health issues. That is, there is a possibility that. So another one is actually contribution. Contribution, how much we are important in our society. Most of the time, you can see, if I take an example of the family, in the clinical situations, many parents are reported that the children, when they are bringing for psychological intervention, they have reported that parents used to take all decisions. The children are not getting, because they think that they are not capable. Because always when we are seeking the children's opinion, it feel, or when we are actually incorporating them into the responsibilities, when we are organizing some program, or when we are taking some strong decisions in the family, or decision may be related to them, when we are involving them, they feel proud and they feel that they are part of the family or they are part of that particular organization. So contribution plays a significant role. When we are making a personal contribution, it gains a sense of purpose and that motivate them into their future life. And the coping and how much they are able to cope up. There are two types of coping we discuss in the psychological literature: adaptive and maladaptive. When people are able to adapt, well and good, but if they are not able to adapt to the normal or difficult adverse situation, they go for alcoholism or smoking or drugs, and it is increasing day by day among the new generations. So building positive and adaptive coping strategies are very, very important. So that is, we should consider as an important role with respect to building your resilience. And control, you can say, we should have a control over our outcome. Maybe with respect to our decision, if you have a control about our decisions, and you will be able to sort it out, or you will not feel frustration. So if you are actually indifferent and helpless, if you become helpless when you are taking some decision, and there is a chance to go into the depression or anxious state. So if parents make all decisions, children are denied the opportunities and learn control. That is what happening in most of the time, because even parents are also moving very fast. They don't have time to spend 5 or 10 minutes with their kids. So that is the reason. So when they deny the opportunities, they create a different image about themselves. It can develop as a pessimistic and depressed feeling among them. So it may not be a clinically amount for a depression or anxiety, but they may show depressive symptoms. Gradually it may develop as mentioned the previous speaker about a surgery related case, it may develop as a borderline personality disorder, or the child may face, if not guided properly, they will get abused, and then followed that they may develop some personality disorder like borderline personality. Or if the family system is not actually nurturing, parents are actually the ultimate heroes in the family, that means the system will go as a narcissistic family system. So all those things are actually a wrong model or wrong warning signs for building up against the resilience. So to build up resilience, we have to think about that. So parents plays a significant role. Building self-confidence. As you know that it is actually built up based on the component, what I have mentioned, the first component, competence. And when they feel they are competent, and they will actually grow as a responsible citizen, and then they will feel a good self-esteem and self-image about themselves, and they are able to change themselves. They feel that they can manage any situation. So parents plays a very significant role by providing genuine praise or balanced praise, or set a reasonable expectation with respect to them, or de-emphasize incompetence. Always the parents emphasize the negativities. That is our mindset. We are always able to identify negative things in the very fast rather than positive. Even if you see, they model it from the husband and wife relationship. Husband always say negative things about the wife, and wife always say the same reaction to the husband. This is actually modeling by the children, so that automatically what happens, they understand this is the system. So parents should model in the beginning in the home environment, so that they will understand. Playing with the strengths So if you look at, if you take any individual, let it be a intellectually challenging individual or retarded or any physical problems, anyone, if you take anyone, they have their own strength. Most of the time parents have lacking their inability to identify their strength and fostering that. So that is what the major issue. So if parents are actually modulate this in their day-to-day life or in the home environment with respect to their children, they will develop a resilient personality. That is the ultimate aim. So as they grow up, as they cross age 15, 16, 17, 18, so as they grow up, they will face lots of adversities. So if they become a resilient personality, if they will develop a good personality, they are able to manage the situation. So resilient personality is nothing but they should feel sense of self. They should have a self-worth and they should feel that they can manage and they can take up the responsibility. Internal locus of control, self-understanding, a good positive orientation about the future, control over the negative behavior or emotion, hardiness. That is actually nothing but it is about control and commitment. Whether they are able to manage the adversities what they are facing in day-to-day life. And ego resilience. Ego resilience is actually, our world is, as I mentioned, it is a dynamic, changing every time or maybe year by year. Different new challenges we have to face. Whether our mind is able to cope up with such kind of difficulties and challenges, that determine the ego resilience. So if we are able to adapt, if we are able to manage such adversities, we say good ego resilience and defense mechanism. So the second, we should, as part of developing resilient personality, interpersonal skill. How many times we are interacting. That's what we mentioned. On an average, a student is spending 4 hours in mobile. That is what actually, or 3 to 4 hours in a day. That is very important for a student or an adolescent. 3 to 4 hours in a day, different times, if they are spending with their smartphones, that will reduce the opportunity to interact with others, building their sociability or learning some emotional expressiveness and interpersonal understanding. Another one is actually, as I mentioned, opposite to ego resilience is ego brittle. So children show behavioral problems or depressive symptoms, anxiety and such kind of things. And then that is the symptoms we have to consider as the warning sign of resilient personality, a wrong model among the children. So when they are showing some behavioral problems, we have to address then and there. Otherwise, it may develop as a different maladaptive pattern or psychopathology. When you think about post-traumatic growth, that is another concept. When a child or adolescent is met with an abuse or negative life event in their life, or maybe a pandemic, or maybe abuse, that will develop as a trauma. It will create a trauma in their life. And so how people are actually develop their post-traumatic growth after they face the adverse event, that depends on the self-regulation. So we have to think about a self-regulation that is very explicit in terms of in our day-to-day life. We have to actually think about developing good self-regulation strategies. Otherwise, self-regulation means able to control over our activities, able to control our day-to-day routine academic activities or decision making. So this actually regulate or enhance their self-regulation. But if the child is actually showing some dysfunctional self-regulation, it may develop as a psychopathology and it will influence the poor resilience skill among them. So in such situation, we have to think about good resilience intervention to build up the resilience skill. So for that, as a first preliminary step, we should understand the personality disorder. As I mentioned earlier, narcissistic and borderline personality disorder plays a significant role, or childhood trauma we have to address properly, and primarily we have to understand their thoughts and beliefs and feelings and needs, so that we can able to manage very well. And you know that we have to provide, if it is actually they are showing some warning signs, we should spend our time, quality time with the children. Maybe we can say it is actually an indication for your parents' attention to their problems. Or maybe we can say sometimes we are actually not worried about it. It's like they will themselves will grow. We provide all financial support or maybe infrastructure, but there is no emotional support. That is very important, because ultimately after you provide everything, if the child is lacking emotional support, and if they are not getting emotional support in the school from the teachers, then it will develop a psychopathology. It may develop as a different problem. So narcissistic family system, if the child is growing in a narcissistic family system, what is narcissistic family system? Nothing but it is parents consider as an important. They are not worried about the children or their simple demands, or maybe they are feeling very much control over the situation. They talk everything about their professional career, their career development, everything. Every time in the dining table or in all discussions, they are discussing about husband and wife professional matters. So that means they are not concerned, or they are not even discussing anything about the children's issues. So it may develop as a continuing conflict between parents and their disinterest in parenting by both of the parents, one of the parents or both parents. So that will actually consider very important role for developing a narcissistic family system. Children who are coming from narcissistic family system actually create a lots of damage, and they will model it, and they will show problems in their social environment where they are interacting with their friends or peers. So we have to think about that. So solution change, what we can provide with respect to that. If the children are coming from those, as a preliminary step, as an intervention, we have to think about avoid poor communication in the family. So enhance a good communication between the parents, between the siblings, so that they will not actually get any confusion. Confusing double talk, that means they are actually get confused, because mother says one thing and father says a different thing. Mother says yes, parent says no, so they will get a confusion. We will say in schizophrenia, we will say double blind communication. It may trigger as a psychopathology, and then it may affect lots of stress to them, added stress because of the maladaptive communication, not listening to their demands or symbol needs, or triangulation. The triangulation is actually, suppose if you have any needs, instead of asking directly to the father, you will send message either through mother or through brother, so that there is no openness for communication. So if triangulation works, the freedom between the parent and children, if it is lost, and it may develop as a problem and stress, and they may depend, when they are facing problem, they may depend their friends, or maybe a close boyfriend or girlfriend, and it may be a misguided information, and then they will end up with a big problem. So another second factor, change the family atmosphere. So maybe we can say atmosphere should be, if it is very fearful, everything should go 1, 2, 3, 4, like obligation. And there are some, if you are not following, the child may develop a guilt, and they will actually develop, as they grow up, they will develop some perfectionism or blaming others, will not take up the responsibility. So that is what they have learned from their family. That's why they will, as they grow up, they will also develop the same thing. If something, some small mistake, immediately parents point out and blame and shout at them, and then it will disturb the family atmosphere and it will create a fear. So we have to think about changing that and create a good thriving environment. So thriving environment is actually the children, adolescents should feel secure with respect to primary care attachment, or maybe with respect to the routine, consistent in the routines. Today one rule and next week another rule. That will create a conflict. And also should be logical. When you are giving instruction, should be logical, minimal rules, and you should model it. And the father says don't smoke, and the father is go to the balcony and smoking continuously. This is a wrong model actually. So we have to actually create first good environment to thrive for them, to develop a resilient personality. And you can see mirroring is actually what I mentioned. It's a synonym for, we can say, modeling. And culture of kindness, safety and acceptance, imperfection. You should have a communication or message to the children. If small mistakes are okay, failure is okay, but we have to work again. Failure, as you know, that failure doesn't mean that is not a negative word. It doesn't mean that. It is actually a simple information. The way you are prepared is not appropriate. That's all. So this message you have to convey to the children. As a parent, we have to convey to the children. So we have to provide self-compassion, and these are the things we have to consider to develop an atmosphere, a thriving and secure atmosphere to build up a good resilient children or good resilient personality. And there are some 3 models I would like to say, resilient intervention models. One is actually compensatory models. Compensatory model is nothing, there are some promotive factors. If the father and mother is against the children, or they are having a very strict rule, but they will find out some hope and care from the grandparents. Grandparents are not like that. Grandparents will support the children. That is considered as the promotive factors. So that is compensatory. One is compensating. If the father and mother is very strict and very creating a fearful environment, but there is a compensatory mechanism by the grandparents. Second is protective model. You can see there is protective model, positive context, social and individual variables are actually promote these factors. You can see there are 2 aspects with respect to this. One is asset. Second is actually resources. So when you think about assets, self-efficacy of the individual, self-esteem of the individual, and when you think about resources, you have relatives, you have teachers, you have mentor, you have advisor in the college system, and you have some social circle clubs, extracurricular activity club, there are some mentors. So you have lots of resources outside your family system. You can utilize that as a protective factors, and it will promote your resilience. So one is compensatory, second is protective factors, and third is challenging model. So as you all know, some anxiety, some stress is very good, but moderate to severe stress, severe anxiety will create problems. So the literature reported that is eustress. Hans say, the stress researcher is very clearly mentioned that eustress, not a stress, distress and eustress. Distress is pathological. Eustress is actually mild stress. So the mild stress actually will help the candidate, help the candidate to overcome or manage the situation. So these three models are very important for the children to build their resilience. So compensatory, protective and challenging model, we have to provide by the parents and teachers, or maybe from the professional people from their professional clinical settings. So there are resilience interventions, you know that there are evidence-based interventions, CBT, or maybe behavioral therapy, mindfulness-based interventions, acceptance and commitment therapy. There are so many interventions are available, but we should understand that what is actually aiming. So we should all interventions are aiming to build up positive emotions among children, control, adaptive coping, active coping, cognitive flexibility. They have to able to understand the situation in different way. If it is actually, if the child is failed in mathematics exam, so the child should not think that my life is gone. Instead of, yeah, this is an indication I have to work hard. That cognitive flexibility or adding some meaning to failures so that they will develop a different value and they can manage. So by training spirituality, and these are the studies, different intervention studies. I will skip this. Different studies available in the literature about resilience interventions. This is Pennsylvania University made a Penn resilience program. This is trunk-based intervention, like different component consists of parenting skills, personal skills, family, education, all those aspects. And there are other studies actually. You can see that one of my studies reported in resilience conducted among pharmacy, healthcare students and physiotherapy and MLT students. We conducted an intervention study. They reported that you can see they were actually control and experimental group. You can see they are able to build up through proper systematic resilience intervention program. So beyond that, one of my study conducted in Riyadh. This is actually among Indian children's a 4-month study period we have conducted and reported. They were actually reported their academic stresses after the intervention was lost. It was significant difference, and they reported improvement of resilience, and they are actually they are able to within short span of time, in 4 months, they are able to develop their good self-esteem. So with this, I would like to conclude that resilience plays very significant role in our healthcare management, because ultimately all healthcare system we are implementing ultimately focusing on the quality of life. So if we can early identify the child or the maladaptive problems in the early stage itself, and for prevent the breakdown before they become adult, we can manage very well and we can ensure a good quality of life. And with this, I conclude my presentation here, and I acknowledge Professor Niloy Sarkar for inviting me here as a keynote speaker, and thank you so much for the invitation. And it is a well-organized program, and I really appreciate it. Thank you once again, and thanks.
Thank you, sir. Thank you, sir.
Sessions. So this particular session has been arranged, just to give the clarity for any kind of doubt. If any delegates who are present over here, if you have any doubt, there are a number of keynote speakers. They have delivered their lecture. So if you have any doubt or if you have any questions, so this particular session has been arranged just to give that clarity. If you have any questions, please raise your voice. Our volunteers are there. They'll be reaching to you to take your question. So I'll be requesting the students, the delegates, the faculty members to come forward if you have any questions to our eminent keynote speaker. Please.
This question is for Dr. Saha. So nice to see you once again over here. Hello. Am I audible? Right. So my question to you is that you have done a wonderful thing that one I have seen with the diagnosis of particular patients or group of patients. Now, what happens after the diagnosis? How does the treatment go to complete the cycle?
As I explained, we predominantly focus on primary care illnesses and the associated public health and epidemiological factors behind these diseases. In primary care, it is the doctor who takes the decision. So, if the illness is such that the doctor feels can be managed at that level with medication and basic tests, the doctor does it. If the doctor feels that the patient cannot be managed at this level and needs a referral, the patient is always referred to the public health system, to state hospitals. And there is a system of regular follow-up, and the doctor can at any point in time decide what he wants to do. The doctor also visits the clinics once every month, so that such patients who the doctor feels I need to see across the table. See, at the end of the day, a doctor seeing a patient across the table, that cannot be substituted by any technology. That cannot be substituted by any digital means. So if the doctor feels that he needs to see the patient, when the doctor goes to the centers, the doctor sees them. We have a team of specialists, cardiologists, neurologists, orthopedics, gynecologists. If the general practitioner thinks the patient needs to be referred, the patient is referred to the specialist also do clinics. If the specialist feels the patient needs to go to the hospital, the patient is referred.
Thank you so much, sir. My next question is to Dr. Alex. Yeah. Thank you for the lovely lecture, sir. I have a question. Especially the adolescence period, we're talking about the behavioral abnormality. Now, do you think that adolescent diet has got any relationship with their behaviors? Is there any link between the adolescent diet they take and the behavior of the mornings, in case you find some?
Yeah, which I would like to say. See, the diet, what we are eating, it plays a significant role. And not only that, if you see the stats, the obesity of the adolescent, if you see on an average, you can see most of the adolescents are having an obesity problem. That may be because of lack of exercise, eating and watching TV, and always spending time, as I mentioned, the presentation with the smartphone. And what they are eating most of the time, it is the fast food. So that definitely is actually affecting their functioning actually. Again, more than that, actually can develop or create a problems to their even academic and brain development, or even other health-related problems. That's very important aspect. Exercise and diet we have to consider very.
Thank you so much, sir.
তোমাদের কারোর কোনো প্রশ্ন নেই, বিকজ a student is supposed to have the most questioning mind. A student's mind is full of questions. একটা ছাত্র তো কনস্ট্যান্টলি প্রশ্ন জিজ্ঞেস করবে। আমি আমি সকাল থেকে কোনো ছাত্রকে কোনো প্রশ্ন জিজ্ঞেস করতে দেখিনি। কারোর কোনো প্রশ্ন নেই? এসো, সামনে এসো, এদিকে এসো। দেখুক যে তুমি একটা ছাত্র প্রশ্ন করছো।
My question is, sir, something struck me very hard. That was when people became aware that the COVID was very much prevalent, they started to just ignore the very fact that COVID was going on. People were roaming around in masks and just violating the protocol that government laid down. Few years after, when I came to this college, I had the opportunity to visit a village where the problem of AIDS was very prevalent in that particular locality. And they themselves also started to just generalize the problem that many people in their village or locality had AIDS. So during your action, what's the icon?
AIDS na HIV positive কোনটা?
Yes, sir, HIV positive patients. So in your course of action that you took in that village, did you encounter similar sort of problems where people have generalized the issue and are just some sort of, I want to say that they are just ignoring that it is present, yeah, I know it, but I don't have to take very much, be aware of it for the protocols or whatever is what has to be followed.
Is perhaps better educated than me in responding to this, but I will respond very briefly. You know, life has struggles. You have your struggles, I have my struggles. Don't think my life is, or I. So, in a person living in that rural ecosystem, with the psychosocial, economic, political environment around him, he prioritizes his problems in life. And when he prioritizes his problems in life, knowledge about disease, appropriate health-seeking behavior, this is called health-seeking behavior, appropriate health-seeking behavior, these are so low in his or her priorities of life because he has got other far more, or what he thinks far more important economic, social, psychological and political factors to contend with, that he gives them less priority. This is one reason. Second reason is the person doesn't know, the person has never been told, the person has never been informed. If you remember the slides, there was one phrase I mentioned, diffusion of innovation. So the idea that you can protect yourself against diseases if you follow certain measures, or if you have a disease, you can access health in this manner and in that manner. The person doesn't have information, doesn't have awareness, because these are not given priority at all. So these are the two reasons. A, lack of knowledge and awareness, and B, lack of priority because of other factors of overriding priority. I can only say this much. I don't know if Arun has anything else to add. He's more knowledgeable.
Let me tell you one thing very interesting. In fact, I was invited for John Hopkins to make some lectures. COVID হচ্ছে infectious disease হিসাবে ভাবলে কোনো সলিউশন বেরোবে না। আপনাদের মাথাতে ঢুকে গেছে যে একটা জীবাণু সে আমার শরীরে ঢুকবে, কিছুদিন পরে ক্ষতি করবে, তারপরে বেরিয়ে যাবে। আপনি শুনলেন যে কোভিড বেরিয়ে গেছে, তারপরেও মানুষ মারা যাচ্ছে। কোভিড চলে গেছে, এখনো হার্ট অ্যাটাক হচ্ছে। আসলে ডক্টর শতদল যেটা কথা বলার চেষ্টা করছেন, বোঝার চেষ্টা করুন। কোভিড নিয়ে খবর কাগজের অনেকগুলো শব্দ ব্যবহার করা হয়েছে, ইপিডেমিক, বিকামিং এন্ডেমিক, প্যান্ডেমিক। সিন্ডেমিক শব্দটা শুনেছেন কোনোদিন? এনিওয়ান? It is a Latin word which means two things amplifying each other. কোভিডের মৃত্যু হয়েছে 0 to 17-এ। আজকে দাঁড়িয়েও কোভিডের যদি হিসেব দেখেন, যে দেশ সব থেকে বেশি হিসেব রেখেছে USA, 0 to 17, যারা ভ্যাকসিন নেয়নি, ডেথ ইজ লেস দেন 0%। 17 to 30, 2%। 30 to 45, 4%, মানে 100 মধ্যে 4 জন। যেই 65 ক্রস করছেন, মেজরিটি অফ দ্য ডেথ। কেন বলুন? বিকজ কোভিড ইজ সিন্ডেমিক। এই যদি ডক্টর শতদলের স্টাফ যদি গিয়ে আপনার ব্লাড প্রেশার দেখে নেয়, আপনারা কজন হচ্ছে নিজের ব্লাড প্রেশার দেখিয়েছে? হাত তুলুন তো। জাস্ট রেজ ইউর হ্যান্ড। Anyone sitting in this hall has got his blood pressure done. Check. You are not sitting in a village. কজন আছে? And when is it that you got it checked? Yes? Let's speak loudly. One week ago. Huh? 1 month ago. Okay. 1 week, sir. Huh? 1 week ago. Acha, 1 week ago. This is recent times. Why did you get it done? It's my home. It's my home, sir. বাড়িতেই করা হয়েছে। না না, কেন করলেন? হঠাৎ ইচ্ছে হলো করলেন? না, অ্যাকচুয়ালি বাড়িতে আমার বড় মার সবসময় করা হয়, তো আচ্ছা সেই জন্য আপনি করে নিলেন। হ্যাঁ, এবার আপনি ভাবুন, এই হলে ইনক্লুডিং মি, none of us get our blood pressure checked daily. ইনিশিয়ালি যখন ব্লাড প্রেশার বাড়ে কোনো সিমটম হয়, কিন্তু ভেবে দেখুন, কেউ যদি আপনার বাড়িতে এসে আপনার ব্লাড প্রেশার দেখে দেয়, তাহলে কোভিডের ডেথ কম হতো। কেন? কোভিড ইজ এ সিন্ডেমিক। যাদের ব্লাড প্রেশার ছিল তাদের আরও বাড়িয়ে দিল, যাদের ডায়াবেটিস ছিল তারা আরও অ্যাম্পলিফাই করে দিল। সো দ্য ওয়ার্ড সিন্ডেমিক মিনস অ্যাম্পলিফাই। যাদের কিচ্ছু ছিল না, নবজাত শিশু, মায়ের কোভিড হয়েছে, বাচ্চার কোনো ইমিউনিটি নেই। I have done my research, not a single newborn died worldwide. We used to keep the mother and newborn together. বাচ্চার কোভিড জীবাণু ঢুকলো, একটা জ্বর পর্যন্ত হয়। কেন বলতে পারে? বিকজ ওর ডায়াবেটিস নেই, ওর হাইপারটেনশন নেই। এই টিমটা উনি যেটা করেছেন থ্রু লট অফ টেকনোলজিস, যে রেগুলার যদি আপনার ব্লাড প্রেশার চেক হয়ে যায়, রেগুলার যদি আপনার ব্লাড সুগার চেক হয়ে যায়, তাহলে কোভিড হোক, অন্য কোনো ডিজিজ হোক, অন্তত আপনি হাসপাতালে ভর্তি হতে হবে না, আপনি মারা যাবেন। ইট উইল বি লাইক এনি আদার ভাইরাস। নিউবর্নেরও কোভিড হলো, কেউ ভর্তি হলো। হ্যাভ আই বিন এবল টু আনসার ইউ? সো প্লিজ রিমেম্বার, আপনার যেদিন প্রথম ডায়াবেটিস হবে আপনি বুঝতে পারবেন, আপনার প্রথম ইউরিনারি ট্র্যাক্ট ইনফেকশন হবে আপনি বুঝতে পারবেন না। কিডনি যখন ড্যামেজ হয়ে যাবে, তখন একদিন কর্পোরেট হাসপাতালে যাবেন, আপনাকে বলবে এরপর থেকে ডায়ালিসিস লাগবে, কিডনি ট্রান্সপ্লান্ট করতে লাগবে, দেন ইট ইজ টু লেট। সো দ্য ওয়ার্ক উইচ হি ইজ ডুইং অ্যান্ড ওয়ার্ক উইচ স্যার ওয়াজ ডুইং, দিস ইজ প্রিভেন্টিভ। যদি প্রিভেন্টিভটা করতে পারেন, আসুক কোভিড, আসুক চিকুনগুনিয়া, ইউ উইল স্টে হেলদি। যদি সবাই তার ব্লাড প্রেশার কন্ট্রোলে রাখতো, আমার হয়েছে, আমি রিসার্চ করতে করতে কোভিড হয়েছে, হঠাৎ দেখলাম 10 গুণ ব্লাড সুগার বেড়ে গেছে, সেদিনই আমি বুঝলাম আমার কোভিড হয়েছে। বিকজ ইট অ্যাম্পলিফাইজ। সো দ্য ওয়ার্ড ইজ সিন্ডেমিক। আগুন লেগেছিল, আগুনকে আরও কোভিড হচ্ছে, যেটা অল্প অল্প দিক দিক করে জ্বলছিল, সেটার মধ্যে ঘি ফেলে দিয়ে দাও দাও করে জ্বলিয়ে দিত। কিন্তু যদি আগুন না থাকতো, তাহলে কোভিড হতো, চলে যেত, আপনার কিছু হতো। দিস ইজ আ লার্নিং উইচ উই হ্যাড, উইচ মিনস দ্যাট এই যে আমরা প্রিভেন্টিভ টিমসগুলো স্কুলও করছে, গ্রামে গ্রামে যাচ্ছে, নট বিকজ তাদের কোনো সিমটম আছে। সিমটম হলে তো তার ব্লাড প্রেশার দেখাবে, যে সিমটম ছাড়া লাস্ট কবে আপনারা ব্লাড সুগার দেখেছেন? আপনাদের ধারণা হয়েছে যে এই বয়সে আমার ডায়াবেটিস হবে না। দুটো পেন নিন, আপনার দুটো চোখ কাজ করে কিনা সেটা একটা সিম্পল এক্সাম্পল। আপনি তো এই প্রফেশনে আছেন, অন্যকে হেল্প করবেন। জাস্ট টেক 2 pens. জাস্ট আমাকে দুটো পেনের এটা করুন। এই কাজটা আপনি কোনোদিন করেন, তবে কাজ করেন, এই কাজটা ওনার টিমটা করছে। দ্যাটস আ ভেরি গ্রেট। আপনি যদি জানেন আপনার ডিজিজ হয়েছে তাহলে ইট উইল নট বি ম্যানেজ, কিন্তু অর্ধেক লোক তার ডিজিজটা যখন বাড়ছে they do not know, and diseases like COVID further increases it, amplifies it. So the solution is prevent this. That is what I have understood.
To the end of day 1. We now take a break for tea. Looking forward to meet all of you tomorrow. The first session begins sharp at 9. Hope to see you all there. Good day and good